healthcare sector is receiving unprecedented attention owing to the COVID-19 pandemic. The HMOs are bridging the gap for effect. A look at the Total Health Trust offerings in this special interview. Improving healthcare standard with innovative and tech solutions, Grover Medical Lagos investment in technology delights stakeholders, especially COVID-19 related care. Plus, a look at happenings around Africa's business and economy in 5 minutes. This is Inside Business Africa, Africa's business news and information leader. Hello, a very good day to you and thanks for joining us. My name is Kenneth Odushola Stevenson and this is Inside Business Africa, Africa's business news and information leader. Like you may have heard on the highlight, we will be taking you through the journey of the healthcare sector today on this episode of Inside Business Africa, as we'll be talking about from total healthcare provision in terms of HMOs and also the healthcare givers. They're talking about Grover, that you may have heard on the highlight. We'll talk about all these when we come back right after this commercial break. Welcome back. It's still Inside Business Africa, Africa's business news and information leader. Thanks for staying with us. Like you may have heard on the highlight, we have said that we're going to be taking you through the journey of the healthcare sector today, especially with the goings on, especially in several countries of the world. The COVID-19 is having a spike. India is crying, and many other countries are also recording unfavorable kind of records of COVID-19 related cases. But today we'll be taking you through first Total Health Trust, one of the major players in the HMOs industry in Nigeria, delivering value to customers and stakeholders. Take a listen to the managing director in this special interview.
Amaka is up and running, getting ready for the day. She manages our customer service function every day and she's passionate about it. After another exciting day at work, Amaka is set to go home. But on our way, she starts to feel feverish. She knows she has to seek medical care before it gets serious. With knowledge of THT network of hospitals around her, she alights and walks into a nearby health center and accessed quality healthcare. Having quick access to quality healthcare had never felt better. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply.
I'm the Chief Executive of Total Health Trust, a health insurance company in Nigeria. We're a proudly Nigerian business, but we are a subsidiary of a South African insurance business called Liberty Holdings. And we have a strong partnership with them across the continent. But for me personally, I have lived in Nigeria now for the last 5 years. Very happy here with my family. It's been a very good experience for all of us. I'm an actuary by profession and by training, but it's not the work that I do every day these days. But I've worked in insurance, in different kinds of insurance for about 23 years now. Our role is really to provide funding for healthcare, not to provide the actual healthcare itself. We sell a product ultimately to our customers that we don't end up providing to the customers. We're heavily reliant on our partners in the actual healthcare industry who provide the services to the patients. Our role is to facilitate that, to play an intermediary role between the customers who are looking for the healthcare and the hospitals themselves. So before we talk about our product and our way of thinking about Nigeria and our role in the country and our role, our small part of society, we sort of work with a purpose which is working together to make Nigeria healthier. And everything we do is kind of driven through that purpose and through that way of thinking. But we offer a range of insurance products that go from sort of full fee-for-service type insurance, where the client pays us a fixed fee or a fixed premium regularly, and in return, we basically pay for all the healthcare needs of the individual on a reimbursement basis to the hospitals. And then we have another range of products, which is a more traditional range in Nigeria. It's our managed care capitation products, where the cover is not as extensive, so the price to the customer is lower, and for which we pay a fixed fee to hospitals for primary care, and then we pay certain more advanced treatments, but it's far more restrictive. And our plans, again, range from providing cover only in Nigeria to plans that cover both Africa and India, and then plans that offer full global cover. So we look at a range of things. The extent of services that you're able to provide as a hospital. So we consider what do you do as a hospital, or what you claim to do, and then we check whether you actually have that capability. So if you're a hospital and you say we offer ophthalmology, so eye surgery, our people will go and check and make sure that first of all that there's a qualified ophthalmic surgeon that works at the hospital, that they have the equipment and the facilities and so on. And then when we market it to our customers, they know, and then we check the quality of the cover, the quality of the care that's provided. We check the standards that they maintain, and then we look at certain administrative processes and back-end processes, things like insurance cover, having the right systems in place, having the right quality assurance inside the facility in place, and it'll differ from depending on the scale of the facility. So if you're talking just to a single general practitioner, you're not going to expect him to have as broad a set of support and services that you would have in a fully fledged state-of-the-art hospital. Our long-term philosophy is that we provide funding for healthcare. So our contribution to healthcare is into the sustainability of the industry, or the whole ecosystem, is that we're able to provide additional input in terms of capital and funding into the industry. So if money is coming in regularly into the provider network and into the doctor's pockets, that they know they have a level of certainty of being able to receive payment for the services that they're providing, they're more willing to invest in their own facilities and to upgrade and to create a sustainable future for themselves, because they know that we're there to provide funding and support to them. But if I think back, particularly over the last year, some of the sort of contributions that we've made. So we, just it's a pandemic and things are very difficult. What we did do is we made a payment for each of our members visiting our healthcare facilities. Every single time somebody visited a facility, we made an additional payment so that they could supply personal protective equipment, or the doctor would be able to have additional personal protective equipment. And that was millions of naira that went out in addition to the healthcare providers in a year that was particularly difficult for them from a financing point of view. The other things that we did, we've done a series of webinar trainings for providers, especially right in the beginning when there was a lot of uncertainty around the pandemic, just how to treat people, how to manage your facility, how to keep your facility and your staff safe. We facilitated and managed a series of webinars around that. So I think, like everybody else that's in Nigeria, the economy is particularly difficult at the moment. We're heavily dependent on the price of oil, so we're all struggling because the economy battles when the price of oil struggles. So cash is tight for everybody, and that obviously has an impact on us selling a service to our clients, because we know that our clients are in a difficult position, that we have to now balance sustainability for ourselves against the squeeze that's coming through with the economy. So over and above the obvious, we also obviously have the cost, the sheer cost of doing business in healthcare, and that impacts our sort of charging structure with our clients, because it's expensive to provide healthcare. things like pure 100% uninterrupted power for a hospital is absolutely crucial. My power goes out at home for an hour, I'm not too concerned. But if the power goes out at the hospital in the middle of an operation, that's a crisis. And having that kind of power supply and clean water all the time that the hospital is having to pay for is expensive. And the cost of that continues to rise for them. Then I think for us as an industry, so those are not industry specific, I guess, but for us as an industry, we have seen some difficult regulation, some inconsistent policy and regulation, and the application and enforcement thereof, which has made it harder to do business. We think in a much better place with the current regulator of our industry, because the level of engagement has improved significantly, and the new regulators wanting to partner with the industry and not taking an antagonistic approach. So as I said, there's probably some inconsistency in between policies and regulations, different arms of the government, which makes it hard and a little bit uncertain. We have had areas of inconsistent application of these policies. But as I also said earlier, we have seen a far greater level of engagement from the new regulator, who's only been there for a couple of years now. But we're seeing a very different approach to the industry, to policy, to governance, and so on. And that encourages us, because it means that as an industry, we're moving in the right direction. We're able to talk to the regulator. I think if the industry and the regulator are talking to one another, you get a far different approach than if they just simply do not communicate. And we've still got some way to go in ironing out the inconsistencies in the regulation or areas that may be of concern. But we do have a forum through which we can do that now, which we are very pleased about. If we all work together, we can really make Nigeria healthier.
For some people, the workplace is without fun, but not for our head of admin, Laolu. With him, there's no dull moment, even when it means attending to so many support requests in a day. Today was quite a workload, and his body seems to be responding with fatigue. It's obvious he needs care, but the closest hospital is quite a distance. Aha! He remembers his HMO has a solution for these kinds of situations. With his smartphone, he had a chat with a qualified doctor using the THT telemedicine app and got his prescription delivered to him. A few minutes later, Laolu is back, ready to take on the world again, thanks to THT. Total Health Trust, working together to make Nigeria healthier. Terms and conditions apply.
Well, there you have it. Total Health Trust, one of the leading player in the nation's HMO, Health Management Organization. This particular organization was one of the first licensed HMOs in Nigeria. You've heard it from the managing director. You've also seen their commercials. You've taken notes. Please get in touch with them, and let's talk about HMO, because it helps, especially on this unprecedented time. When we come back right after this commercial break, we're going to be talking about Grover Medical, a very important health care giver in Lagos. It's a hospital, but with so many innovative technology. We talk about that when we come back right after this commercial break. Welcome back. You're still inside Business Africa, Africa's business news and information leader. Thanks for staying with us. Indeed, Grover Medical, we may call it lifestyle hospital, but it has gone beyond lifestyle to also offering innovative technology and innovative ideas in healthcare delivery. In recent times, with the coming of COVID-19, that particular organization has done a lot of investment in some major equipment that will help people with this very dangerous disease. They put together a very important center that could actually take care of this responsibility, take care of this particular pandemic, and in terms of testing and also in terms of treatment. We have been speaking with Dr. Glover. He wants to be called Chief Grover, who actually is the brain behind this important and innovative hospital. Take a listen.
My name is Chief Grover. I'm founder, chairman and managing director of Grover's chain of hospitals and pathology labs. We are into healthcare services, medical services and diagnostic services. We started Grover's Hospital and Grover Medical's diagnostic lab 5 years back, and we are happy to be associated in the healthcare industry. We feel honored and we feel great. This is an opportunity to serve the needy COVID-19 patients, because many more facilities are required where COVID positive patients can go there, treat themselves and recover very well. So more and more facilities are required, and recently Grover's Hospital was given approval and authorized by AFEMA and Ministry of Health of Lagos State to render medical services to treat COVID-19 patients. It's a privilege, it's an honor, it's a duty to serve the needy patients. We wanted to set up a COVID treatment center last year, but at that time our facility was not ready with the ICU. So there are a couple of things which we did this year in January. A dedicated separate top floor unit was created for only COVID management, COVID treatment, with a separate ambulance bay, with a separate entry, with a separate ramp to move to that floor without interfering into the green zone area. And also as a responsibility, we ensured that a world class critical care unit with advanced ventilators was set up, and staff was given adequate training before we started this COVID treatment center in Grover's Hospital. So this area is an ambulance bay. From this area, ambulance brings the COVID patient inside, and this is a separate entry. A special passage has been created to go to the isolation unit. So from here, through the ramp, the COVID patient is taken to the COVID isolation unit on the top floor. Okay. Yeah. You are welcome to the critical care unit for COVID-19 patients. Those patients who need ventilation, they are brought into this critical care unit, dedicated ICU for COVID-19 patients. We have 4-bedded ICU with advanced ventilators and monitors to give them life support. And those patients who are critically sick, where the oxygen saturation level goes down, this is highly advanced ICU in Grover's Hospital, which is managed by the very well trained intensivist and respiratory physicians and critical care physicians. There are challenges, but responsibility is always bigger than challenges. Where there is a will, there is a way always. Our main motto and vision was to save lives. A lot of people were dying with COVID-19 infection. So our main vision and mission was to save lives. That is our main responsibility. And to perform this responsibility, we took all the initiatives. We took all the biggest responsibility was to ensure that we invest adequately into this setup, which our board of directors approved, our investors approved, and we are now trying to help the community to stop this spread in the society by our regular medical bulletins and communications through social media, so that people know how we can stop this spread of this COVID-19 pandemic. That's our responsibility, which we are going to deliver in the time to come also. Some challenges were there in terms of infrastructure, some challenges were there in terms of finance and capital, to raise the capital of funds, but we thank God, finally our financial institutions like CBN, our bankers, our advisors, they helped us to go ahead and set up this infrastructure, and there was a great help in terms of guidance from Ministry of Health, NCDC, as well as AFEMA team to set up this facility, and finally they approved us. You know that healthcare professionals, medical professionals, they have to come forward. It's like a war. In the war, someone has to take the responsibility to fight the war. Similarly, in this COVID-19 is like a epidemic and wars like situation. Healthcare medical professionals have to come forward and take the responsibility. And how do we manage and ensure that our clients and staff, they are safe? There are three things which we do. One, all IPC, infection prevention control guidelines, and all their protocols are strictly followed. We do not compromise on the safety parameters. We do not compromise on the procedures which are to be followed before going and seeing the patient. And second thing is, most important, waste disposal. In COVID treatment center, waste disposal is very important. How do you dispose your PPE kits? How do you dispose your gloves? How do you dispose your used consumables? So we have a dedicated team and a unit which takes care of waste disposal. That medical dedicated waste disposal team takes care of all the precautions so that our staff, our clients, our community is safe. And third thing is, we ensure that green zone is separate from the red zone. Clear-cut demarcation is there, and staff, they know when they are not seeing the patients where they are supposed to sit, where they are supposed to rest, where non-medical team also. So green zone is separated, clearly demarcated, and all precautions are taken in terms of sterilization, disinfection of the wards regularly. These are the preventions and protocols which we take to ensure that everybody is safe. Our patients are safe, our staff is safe, our community is safe. This is the entrance as well as the green area where the staff and the patients who come, they come from this area, and this is the area where they are attended initially before they go into the outpatient department or the consultation area. This particular ground floor area is reserved as a green zone.
We are almost spent 21 years in Nigeria, and is a really lovely country. We enjoy the life, culture, and now that we almost spent 21 years, then we have decided that we can do some contribution in health sector. So that's why 5 years back we opened our Grover Hospital, so we can give the good service, world class services to our clients, so they can be satisfied. There is no need to go abroad for health facilities. So we are slowly we are trying to develop so many things in health sectors. Like mostly I saw that most of the patients for tertiary surgeries, they are going abroad. Okay, so we are planning that we can bring the surgeons here, and so we start the surgeries here. So there is no need to go the patient to abroad. So we want to provide these services here.
This area is a dedicated modular operating theatre where all type of surgeries are performed here. We have a dedicated well-trained team of surgeons, orthopedic surgery, general surgery, neurosurgery, all type of surgeries are performed here, and including even gynecology surgeries like cesarean, myomectomy, hysterectomy, all type of surgeries are performed here.
Well, congratulations to Grover Medical, and also for doing it very well in the healthcare sector in Nigeria, and also investing, especially in these trying times, to ensure we meet up with the modern times. We want to say we are very proud to be associated with the growth of this organization and this hospital. Over time, we've actually spoken with the Chief Medical Director, Dr. Grover, and Chief Grover and her wife on what they are doing in Nigeria, especially in this industry. We thank you very much indeed. When we come back, right after this commercial break, we'll take you around Africa in 5. Is still inside Business Africa, Africa's business news and information leader. In line with our title, we'd like to take you around Africa in 5 minutes to look at the happenings around the business, economy and finance across the continent. Well, I'm afraid that's about all we have time for on Inside Business Africa for today. I want to thank you again for being a part of the program, and also to inform you that our special coverage on the health sector will continue in the next edition of Inside Business Africa, where we hope to be speaking with other HMOs and other caregivers in the country. And indeed, Inside Business Africa is available also on YouTube, Instagram, and also on Facebook. All our social media handles are quite active. You want to also engage with us when you visit all those channels, so that we can also get some feedback as to what you think about Inside Business Africa. It's been Kenneth Odushola Stevenson presenting. Thank you again for watching. See you next time.